Hello, hello, everybody. Welcome, welcome. We'll just give it just a few more seconds. Okay, see, folks are joining us on this webinar. Recognize a few names. Okay, we'll give it one more minute so people can join us. In the meantime, those of you who are joining us from all over the world, if you can chat where you are joining us from, including the panelists. I actually wrote it on my sweatshirt. I'm joining from St. Paul, Minnesota today. Joining from Minneapolis, Minnesota. Minneapolis, we have a Minneapolis crew today. Duluth, that's where I went to school. Minneapolis, Minneapolis. Well, as all of your locations roll in, we're gonna get started with today's webinar. We have a few of you joined Uzbekistan. Great, welcome, welcome. I will get started with today's webinar. Welcome everybody to the University of Minnesota. My name is Marina Uehara. I use she, her pronouns, and I'm the Director for Student Engagement and International Student Scholar Services. It is my honor today to welcome you to the Spring 2024 Global Gopher Experiences webinar. This webinar is in preparation for the start of your Spring 2024 semester, and I look forward to seeing you all at our January 11th welcome dinner in a few weeks. Ray will be putting on the chat, if you haven't registered for that, a link on how to RSVP for that dinner. Thank you, Ray. We affectionately call you Global Gophers, as the Gopher is the University of Minnesota official mascot. And the term Gophers is what we call all of our students and all of our people at the University of Minnesota. So you're global because you're around the world, and Global Gophers is our affectionate name for you all international students. According to our student surveys, we know that the #1 concern of our international students is health and well-being. So today specifically, it's not about maintaining your physical health, but also your mental health or your mental well-being. We want you to be happy. We want you to be well when you're here as a student at the University of Minnesota. Both are equally important for your success here as a student. We also know that the US healthcare system is quite complicated and confusing. Trust me, I've been an international student a very long time ago, and I've been here for many, many years, and I still get very confused. But fortunately, today we have Greg who's going to join us and explain to us how to navigate the US healthcare system. And he'll share some common terminology as well for all of you. It is critical for you to know how to navigate and use the University of Minnesota services and health resources. So we are fortunate today that we have multiple campus partners that will be sharing clear information and next steps for all of you. We also want to assure you that hundreds of students successfully navigate the healthcare and well-being system every year. And they all ask for help when they have to, so don't be afraid to ask for help. I will now pass it on to my graduate student leader, Ki Win, to do an overview of today's webinar.
Hi all, I am Ki. I'm a first-year master major in counselor education with lean on like clinical mental health areas, and I'm currently a graduate consultant at ISSS. About this webinar, it will be recorded and posted on ISSS website, and we recommend using like a gallery view or speakers so you can see kind of like all of us and also like the presentation at the same time. And if you have any specific question, don't be afraid to reach out to like ISSS or any of our partners about that specific question. And the first 30 minutes, all the panelists will like introducing themselves and reviewing general information related to health and wellness. And our partner today include Boynton Mental Health Service, Office of Student Health Benefit, and Office of Housing and Residential Life. And we'll be answering Q&A question with the pre-submit question during the registration. And you can submit the question by using the Q&A function below. And you can submit the question anonymously too. So now I would like to introduce Katie Olson-Williams from Housing and Residential Life, sharing about housing information.
Thank you and welcome. Good morning. As introduced already, I'm Katie Olson-Williams. I use she, her pronouns, and I'm an assistant director here in Housing and Residential Life. Housing and Residential Life provides housing to over 7,400 students on campus within 17 buildings located on the East Bank, West Bank, and St. Paul campus. We provide opportunities for students to meet others. We have staff that live on site as a resource and for crisis response. In addition, we have almost 40 unique living learning communities where students live in a community with others that share the same academic goals or personal interests. Move-in for our spring residents to our apartments begins January 5th, so in just 2 days. Or if you're in a traditional residence hall, you can return on or move in on January 13th. If you have not yet found housing for spring semester, we do still have space available and are still accepting applications. If you do plan on living with us, please be aware of your contract terms. I also encourage you to review our website there, listed related to roommates. So as you may know, living with somebody new can present some of its own unique opportunities and challenges. And so we really want to help you in that transition of living with someone else. Certainly, if you are living on campus and you have any issues with your roommate, please do ask for help early. We, again, have CAs or community advisors. They are your peers. They are students that live on your floor and that are there to help you navigate that transition. Next, please. So your health and safety is very important to us, as Marina mentioned. So the pages that are listed here on this slide are really for you to be aware of. And, you know, it is all of our responsibility for our own health and safety. We no longer have any specific protocols for COVID. However, our website does have some resources available if you have questions about what to do if you feel sick, if you have been exposed to someone with COVID, and updates around policies such as masking. Masks are not required unless you are isolating. However, community members are welcome to wear one if you wish. We encourage everyone to take responsibility for their own health needs and to do the right thing when not feeling well, such as testing and isolating if necessary. As a student, it is important to take care of your own well-being. There are several opportunities in Hall to connect with others, including jobs within housing and residential life. So you may actually work where you live, or you may want to create and or participate in one of our many groups with other students living in our buildings. Our staff are available as a resource to you in each Hall community, but we all play an important role in our community. Should you experience or witness a bias incident, please report it as soon as possible to your CA or submit a report to the Bias Response and Referral Network, or BRNN, so we can support and follow up. Knowing which resource to use and why at the university can seem overwhelming. The Bias Response and Referral Network is here to refer students, faculty, staff, and members of the public to appropriate support resources. The BRNN responds to bias incidents on the Twin Cities campus in ways that support those most impacted, promotes education and dialogue, and affirms the university's commitment to equity and diversity, free speech, and academic freedom. The BRRN does not have an investigative or disciplinary role in responding to any bias reports. We encourage anyone who has experienced or witnessed an act of bias to file a bias report at the website that was shared. An individual can file a report anonymously, or they can choose to identify themselves. The BRRN defines an act of bias as an act of bigotry, harassment, or intimidation that is motivated in whole or in part by bias based on an individual's or group's actual or perceived race, color, creed, religion, national origin, gender, age, marital status, disability, public assistance status, veteran status, sexual orientation, gender identity, or gender expression. If you have questions, again, lots of links, lots of information, but please do not hesitate to reach out, as we are here to help you be successful in your transition to the University of Minnesota. Our next presenter is Michelle Trumpy, Director of Public Health at Boynton.
Good morning. I'm so glad to be with you this morning. Boynton Health is very interested in helping you make sure that you are your healthiest, best self while you are at school here at the University of Minnesota. Next slide. We've been taking care of students for over 100 years, and we are very comfortable with helping new students navigate through the healthcare system, which is what Marina was talking about. We have lots of services here at Boynton. I'm going to touch on some of them, and it is completely normal and natural to have questions. And so there's a lot of people here who can help you navigate, and a lot of links for you to look in as well. And so we hope that you call Boynton to take care of your health needs. Next slide. Boynton is a comprehensive health service that offers many services, mostly under one roof here on the East Bank. I just want to talk about a couple of items, a couple of services that we have. Primary care. If you need a regular annual checkup, primary care is where you can get that to keep yourself healthiest. Mental health is another really important service that we offer. If people are feeling stressed out, if you're having some challenges acclimating, if you're feeling lonely, if you're just not quite sure, mental health is a great stop for you. We have brief counseling to help you determine what services you need. We have regular therapy where you can talk to a therapist on a regular basis. And we also have medication services if that is needed as well. We have a comprehensive eye clinic, and one comprehensive eye exam is included in your insurance benefits. And that's something really important to get your eyes checked every year, even if you don't wear glasses or contacts. Next slide, please. We are located primarily on the East Bank, right behind the Union, and our hours are Monday, Tuesday, Wednesday, Friday from 8 to 4:30. And on Thursdays, we open just a little bit later at 8:30, and then we close at 4:30. And then we also have a clinic on our St. Paul campus, which is open Monday, Tuesday, and Friday. Next slide, please. There are many ways that you can get treatment at Boynton. You can call our appointment line, and any service, primary care, the eye clinic, the dental clinic, mental health, they can help you get directed into where you need to go. You can also schedule online in the portal, which is a great service. If you are needing an interpreter for an appointment, you can request one, and that is a service that is offered and is completely free to you. Sometimes people want to have an interpreter during a medical appointment because that language is just a little bit different. And so I just want everyone to know that is a free service available to you if you ask. You can go to urgent care if you have an issue that's requiring prompt service. Perhaps you have a severe headache, you have frostbite, you've got intense respiratory issues or nausea. Those might be some reasons that you go to urgent care. You don't make an appointment, you walk in to get care there. And then another really important resource that we have is our nurse line. Our nurse line is available 24 hours a day, 7 days a week. So if you're not sure if you should go in, if you should go into urgent care, maybe it's at night or on the weekends when Boynton is closed and you're not quite sure what to do, the nurse line can be a really great call for help to help you determine if your issue can wait until Boynton is open, for example, or if you should go in right away. We also have on our website information for after hours care. I'm actually going to put that in the chat for you, where to get care if Boynton is closed. And again, I encourage people to call that nurse line to help determine if you need to go in right away or not. Your benefits have the best coverage here at Boynton because of the student service fees. You can certainly go elsewhere, but I just want people to be aware of the resources that are available to them. Next slide. There's a lot of information about your health and well-being, and a lot of information about immunizations and vaccinations as well. So this QR code helps get you to that spot on immunizations, but we'll go through a few key details next slide. All students are required to have 2 vaccinations, the diphtheria and tetanus, also known as the Tdap, and then the measles, mumps, and rubella, which are actually 3 vaccinations in one. So it's 2 shots, and you need to report you having those vaccinations by the 6th week of class. And if you don't report that you've had those vaccinations, you'll get a hold on your schedule, so you're not going to be able to register for your next term. So it's really important that you get that done. It's a really easy online form, and I'm going to put that in the chat. And there's a lot of resources to help you get those vaccinations done. We have a drop-in clinic on Mondays and Wednesdays from 8 a.m. to 3 p.m. where you can get your Tdap shot. If you need to get your MMR, you can make an appointment. You can either call or you can use the portal, as I said in the previous slides. We also have many recommended vaccinations to help you live your healthiest, best life. There's 2 meningitis shots. There's the HPV series, which is a 3-shot series, the hepatitis B series, and an annual flu shot and COVID-19 shot. We get a lot of questions about this of, I've already gotten that in the past. Do I need to get that again? And those are vaccinations that are updated every year. And so if you haven't gotten it yet for this season, it is highly recommended that you get your flu and COVID shots. And again, you can get those vaccinations in the drop-in clinic Monday and Wednesday from 8 to 3, or you can make an appointment where you can talk with a nurse about your vaccination needs. Next slide. So right now it's respiratory season, and sometimes people feel sick and they're not sure what to do, especially around COVID and influenza. And so here are some top tips on what to do to stay healthy. First of all, stay home if you're feeling sick. It's okay. It's okay to miss class. Just let your professor know that you are feeling sick. It is policy that you are allowed to stay home. You don't need to have a note or anything like that. Just be in communication with your professor. It's okay. We want you to stay home and take care of yourself, and we don't want you to get other people sick. You can test for COVID-19 if you're feeling sick. There's a very low cost test kits, home test kits available at our pharmacy. And the Minnesota Department of Health also offers free tests for those who request them, and I'll put that in the chat at the end here. If you do test positive for COVID-19, it's important that you follow the isolation guidelines, which means staying home for the first 5 days and then wearing a mask from days 6 through 10. If you're feeling really sick and you want to get tested, you have symptoms, you can come into Boynton and we can test you for COVID and influenza. I already talked about vaccinations, but it's really important that you stay up to date with your vaccinations. That is one of the best ways to protect yourself against influenza and COVID. And even if you get the vaccinations and do get sick, it really protects you against severe disease and hospitalization. So if you get sick, it's much more mild. And it's really important to wash your hands. Wash your hands regularly with soap and water, and that's one of the best ways to protect ourselves from a wide variety of sicknesses, especially during this winter season. Next slide. It's important for you to know that the University of Minnesota is a smoke-free campus, both inside buildings and outside, anywhere on campus. So this includes cigarettes, includes e-cigarettes or vapes, and it also includes cannabis. And there had been some questions around cannabis because that is legal now in Minnesota, but it is not legal to have on campus. So it's important to know that. If you need help quitting tobacco or you're interested in learning more about that, there's a link. You can come into primary care and be prescribed some medication to help you quit smoking. Next slide. Boynton Health has a food pantry called the Nutritious You Food Pantry. This is a really important resource for people who may not have enough resources to get enough food to eat. So students are welcome to visit the food pantry twice a month. It's held the second and fourth full weeks of the month, Tuesday and Wednesday, from 12 to 5. And there's no verification that's needed. All students are welcome, and we have many international students who visit our food pantry. Next slide. The Gopher Chauffeur is another program Boynton has that offers free late night rides to students 7 days a week. We operate during the school year, so the first night of rides will be on Tuesday, January 16th, and we'll operate through the spring semester, and then we start back up in the fall. You have to download an app to request a ride. This QR code helps you get to that app, and you can read more about it on our website as well. Next slide. I encourage everyone on this call to check out our PAWS program, the Pet Away Worry and Stress. This is a program that brings registered therapy animals to campus 4 days a week in multiple locations. And it's a really great way to connect with an animal, to connect with fellow students, and to truly pet away worry and stress. We have a lot of international students who are missing their animals back home and really love participating in this program. So I really recommend that you check out the schedule and come visit us. We will be starting up this program that first week of class. Next slide. I'm really excited to talk with you about health advocates, especially for any students who are living in the residence hall. These are students who are peers who can help connect you to different resources. Next slide. It's really easy to get a hold of them. I've put the contact form here in the link. And so if you want to talk to a health advocate, you just fill out that contact form. They'll be starting up their work again in the new semester, so January 16th. They're first aid and CPR certified. They respond to common health issues. So if you're not sure, for example, if you need to go in, if you're not sure if you might want to check out mental health therapy and you want to ask someone about that, ask about their experience. If you have a headache and you don't think you need to go to the doctor, but maybe you want to try some over-the-counter medication, a health advocate can absolutely help you. They have a little kit with some really common supplies, cold and cough medicine, cough drops, they have Band-Aids, safer sex and healthy relationship supplies, and they're a peer. So they're same age, students as you, going through similar things, and they can be a really great resource to talk to. So if you live in the residence hall, I definitely encourage you to check out the Health Advocate Program. Next slide. There's so many programs at Boynton, we didn't get a chance to talk about all of them, but I do want to point out a couple final ones. We have safer sex supplies that are available for free across campus. They're available at Boynton. People can put in an order. They're at the residence halls with the health advocates and Greek houses. So it's really easy for you to connect with that. And then we also have recovery on campus for students who are questioning their use of substances, whether that be alcohol or other drugs. It's a really supportive group. We also have connections in our mental health therapy clinic if people are questioning their relationship as well. So the link here is for ROC. And then my last slide is just a link back to Boynton's website. There's so many resources we have to help you live your healthiest, best life. And so I encourage you to check it out, and I look forward to seeing you on campus. And our next presenter is going to be Greg Thurston, who's the Director of the Office of Student Health Benefits.
Hi, as Michelle said, my name is Greg Thurston. I'm the Director of the Office of Student Health Benefits. Today, I want to highlight health insurance requirements for the University of Minnesota, as well as some of the items related to health insurance in the United States that's probably different from the health insurance you have in your home country. As Marina said at the beginning of the webinar here, health insurance in the United States is complicated, even for those of us who were born here. In the few minutes we have now, I can only give you a general overview of how it works. The booklet with all the health coverage information, which is known as a summary plan description, is actually over 100 pages long. If you're really interested in getting into the real fine details of the health coverage, you can look at that. It's on the Student Health Benefits website. After this presentation, you're probably going to have additional questions at times in the future. And I want to assure you that the Office of Student Health Benefits contact information, let's go to the next slide, please, actually. So the Office of Student Health Benefits website information is provided here. And I want to assure you that we're committed to helping you with any questions you have, either now or in the future related to health insurance coverage. We can go to the next slide, please. First, it is important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be either on the university's student health benefit plan or the university's graduate assistant health plan. This requirement has been in effect for over 40 years and applies to all university students, both domestic and international. The requirement is there because it allows you to focus on academics and not worry about whether you can obtain medical services if any issues arise. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. However, there's only a few countries that have such arrangements. Those countries are Oman, Saudi Arabia, United Arab Emirates, and Kuwait. And so if you're from one of those countries and you qualify for a waiver, or you have US employer-based coverage, then you should contact the Office of Student Health Benefits for assistance with the waiver process. We can go to the next slide, please. If you're a graduate fellow or graduate assistant with a qualifying appointment from the university, you should enroll in the Graduate Assistant Health Plan. The university pays a significant portion of the premium for a graduate assistant, so that means that your contribution would be very low. At the beginning of the semester, your account's charged just $195.48. And then if your appointment is 50%, you pay no additional premium. If your appointment is less than 50%, then you do pay an additional amount for the semester based on your appointment level. You have to complete an enrollment form to enroll in the Graduate Assistant Health Plan. To enroll, you go to our website, which is shb.umn.edu, and then you select Graduate Assistance and then select Enrollment. You complete and submit the form to the Office of Student Health Benefits. Need to point out that failure to actively enroll in the Graduate Assistant Health Plan would result in the graduate assistant being automatically enrolled in the Student Health Benefit Plan and charged its full cost of coverage. And you don't want to have that happen. So if you are a graduate assistant, you want to make sure that you enroll in the Graduate Assistant Health Plan. Graduate students without appointments and all international undergraduate students who do not qualify for a waiver must enroll in the Student Health Benefit Plan. Coverage generally begins on January 16th of 2024. However, if you need services prior to that date, please contact the Office of Student Health Benefits and we can have coverage be effective the date that you enter the United States. The cost of the student health benefit plan is $1,795 per semester, and it's billed to your account at the beginning of the semester. To enroll in the student health benefit plan, you simply click Enroll Me on the insurance plan communication that's sent to your MyU account. The Office of Student Health Benefits does not recommend purchasing any additional insurance. And even if you choose to do so, it will not allow you to waive off the student health benefit plan. Next slide, please. In the United States, even with health insurance coverage, an individual may have some additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription. For example, the graduate assistant plan has a $10 office copay. So you would pay that $10 every time you have a visit. And then after you pay that copay, then the insurance plan generally pays the remainder of the cost of the visit or the prescription. With the student health benefit plan, when you have services outside Boynton, you may need to pay a deductible and coinsurance. So the deductible on the student health benefit plan is $250 per year. So if you remember when Michelle was talking about having services provided at Boynton, most services provided at Boynton, what happens is they'll bill your insurance. So they'll bill the student health benefit plan. And then if you're paying student service fees, like all international students on the student health benefit plan are, the student service fees will cover the remainder of the cost so that you don't have any additional cost. However, when you have the services provided outside of Boynton, you'll have that $250 annual deductible that you'd need to pay before the plan would pay anything. There's also coinsurance sometimes, and coinsurance is a percentage of the claim that you must pay with the insurance paying the remainder. So again, on the student health benefit plan, you have that $250 deductible that you need to pay. But then once you pay that, the plan pays 80% and you pay 20% of the remaining charges. So again, all that is avoided when you have the services provided at Boynton. So to the extent you can have your services provided at Boynton, it's the best thing to do. However, even with the deductible and the coinsurance, all the plans have a maximum annual out-of-pocket amount, so that once you reach that amount, the insurance does pay 100% for all remaining eligible charges. The Office of Student Health Benefits has detailed information on its website showing the coverage levels for different types of services for each of the health plans. So let's go to the next slide, please. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. So as we've talked about, Boynton Health is usually your lowest cost and most convenient alternative for medical care. In fact, most services provided at Boynton result in no out-of-pocket cost to those on the student health benefit plan, and just a $10 copay for those on the graduate assistant health plan. The medical identification card you receive for the insurance company will have their website information, enabling you to find other available in-network providers when needed, such as if you require immediate care when Boynton is closed, or if you require a service not provided by Boynton. So you would want to go out to their website, find an in-network provider. What that means is in-network providers are providers who have contracted with the insurance company to have a certain maximum amount that they're going to charge for their services. And so it reduces the cost that you would have to pay. So you really want to make sure that you're going to providers who are in network when you're not going to a Boynton provider. The insurance company that we use is called Blue Cross Blue Shield of Minnesota, and the provider network is called the Aware Network. So you do need that medical identification card when obtaining services or picking up prescriptions at places other than Boynton. And then again, if you're going to any place other than Boynton, you want to confirm with the provider that they are in network before obtaining those services, as you usually have to pay more out-of-pocket costs when utilizing providers who are out of network. Now, the medical identification card that you'll receive, it typically takes a couple of weeks to receive it. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We'll be able to get you a copy of it, a paper copy that you can print off online. We're here to assist you and help you with any questions that you have about your medical coverage. The next presenter is going to be Marina, who's going to talk about international student and scholar services.
Thank you, Greg and Michelle and Katie, for presenting on today's very important information on how to navigate the University of Minnesota. So in order to stay connected with our office, International Student Scholar Services, or ISSS, or ISSS, please email us at issssnew@umn.edu. You can see our website over here, isss.umn.edu/new. We have a Discord channel as well as an Instagram account with our Global Gopher influencers. Again, as a reminder, there are a lot of ways to connect with ISSS and the partnering office today on this webinar. So if you have specific questions, you can email those appropriate offices. We'll be sharing their contact information at the end of the webinar. But for right now, if you just don't know where to start, you can email us at issssnew@umn.edu. And lucky for all of you, the people behind that email account are here today to also answer questions should you have any questions. So with that said, we will now begin the question and answer portion, or the Q&A portion of this webinar, for the last about 20 minutes. We will have staff moderating the chat, so please feel free to submit your questions during this time. If you don't know how to submit a question, at the bottom of your screen, there's two bubbles that say Q&A, questions and answer. You can click on that and submit a question with your name or anonymously, but I did receive a few pre-submitted questions, so I'll be asking those today. Before we get going, I'll go to the next slide so you can see the email contact information for all of our campus partners. And I will be asking folks who have not introduced themselves to do their introductions today. So I have the honor to pass it on now to Lisa, who will be introducing herself.
Hi, everybody. My name is Lisa Ziegler. I use she, her pronouns, and I am one of the staff at ISSS that manages our ISSS new email inbox. And I also work with our ISSS check-in and the welcome session program. I will pass it to Nuchi.
Hi everyone, my name is Nuchi Zhang. I am the new student specialist in ISSS, and I am also the other person who manages the ISSS inbox. I'll pass it on to Mary Beth.
My name is Mary Beth Polk, and I am an international counselor in ISSS. That just means that if you have any questions about your F1 student visa, I can help answer those. I'll pass it to Robert.
Hello, my name is Robert Knapp. I use he, him, his pronouns, and I am the Recruitment and Student Services Coordinator at ISSS. I work with undergraduate student population, and also am here to answer questions that are needed. I'll pass it on to one of our ISSS graduate consultants, Ki Nguyen.
I think I have introduced myself, but I can do it again. My name is Ki. I'm a first-year master's student in counselor education majors in clinical mental health areas. I'm a graduate consultant, and I will pass on to Shimen.
Hi everyone, I'm Shiman Li. I use she, her pronouns. I come from College of Design majoring in apparel studies, and I work in ISSS as a graduate consultant as well. And I will pass on to Ray.
Hi everyone, my name is Ray, use he, him pronoun, currently a senior studying psychology in CLA, and I'm a senior supervising Global Gopher leader, and feel free to ask me any question if you want to, and I'll pass it to Soliana.
Hi everyone, my name is Soliana Shukur. I use she, her pronouns. I am a sophomore studying computer science and also part of the GDE team. Feel free to ask any question. Thank you.
Thank you, everybody, for taking the time to introduce yourselves. I know it's super important for all of you attending here to see who are the people behind some of the emails that you are sending to. So I will get started with a few of the first questions we have received. We have some questions regarding housing. Katie had to leave a little bit early, but we do have some student representatives to talk a little bit about what it's like to live off campus. So Ray and Key, if you could take turns, perhaps you could tell us what is it like to live off campus, and how can I navigate the Gopher bus system and the Gopher tunnels, which is super useful to know during winter. Ray, I'll pass it on to you first.
Sure. So living off campus is just like you have apartment of your own. You kind of live off campus, which probably near campus. So you kind of travel when you go to school. So we have like school bus and near around the campus, and you can download an app called Gopher Trip, which take track of the location of the bus around the campus, and it pretty accurate shows where it shows up, so you don't have to really wait outside in the cold winter. And also we have light rail and free transit pass. So basically it's pretty easy to transport around the campus. Hugh, do you want to add anything?
I can add on. Yeah, same as Ray. I actually live in Minnesota since my freshman years. I live in Middlebrook Hall, and since after that, I moved off campus living. And yeah, Gopher Trip is like an app that I always use. It's have like on a school bus, like information with like you can put on a notification of like how long the bus will arrive to. And usually I just put on like, notificate me 5 minutes when, 122 or 123, depends on which location you want to go. So 123 is like the most like common one that go off to St. Paul. And then the rest one, oh no, I think it's 122. Yeah, but then the rest of one is like go around the school campus, East Bank, West Bank. But yeah, so off campus, for me, I would like because I cook a lot. I love baking, especially like banana cake and stuff. So yeah, I get a chance to kind of go like grocery and then cooking. And on campus, usually we do like the meal plan, so it's all included in when you charge for like tuition and stuff.
Thank you, Key and Ray. Could you also let us know what are some of the resources around off-campus living? And if you could share some of those over the chat. Thank you. We have some other questions as well. I see a few Q&A questions that are popping through, but I'm gonna go ahead with some Boynton related. Actually, I'm gonna move to student health benefits plan. I think that's where we get a lot of questions. So Greg, if you're ready, I'm gonna be firing a few questions for you. I do have questions around what happens when a student is outside their funding band. What is the cost of paying your own health insurance?
When you say outside the funding, so they're no longer they're not a graduate assistant, or what, or they, so because there's two different plans, right? So if they're appointed at the university and they have a qualifying appointment, they're just going to pay that $195 for the semester for the graduate assistant health plan, assuming they have a 50% appointment, which most of them do. Now, if you don't have an appointment, so if you lose your appointment and you have to go on to the student health benefit plan, then the student health benefit plan costs $1,795 for the semester, which is the equivalent of $300 basically per month that the charge would be.
Thanks, Greg. So it seems like if you have specific questions, the best bet is to reach out to the Office of Student Health Benefits, because then they can give you a more tailored and specific response. As you noticed today, Greg had to give us 2 responses. I do have a live Q&A for you, Greg. I would like to know what I need to do to activate my dependents' health insurance, and thank you.
Yeah, there's an enrollment form for the University of for the plan. So depending on whether you're on the graduate assistant plan or the student health benefit plan, the easiest thing to do is to contact OSHB. You can just email them or call them during our business hours, and they can get the information to you so that you can get them enrolled.
Thank you, Greg. A few more questions for you. Does my insurance start right away, and am I signed up right away when I arrive?
Yeah, I mean, you if you're arriving prior to the official start of the coverage, which is January 16th, which, presumably everybody is arriving prior to that. If you need the coverage to be effective the day that you arrive, you need to contact the Office of Student Health Benefits, because it's a manual process to have the coverage start prior to January 16th. So it doesn't automatically happen that you're covered, the moment that you get off of the airplane. But if you need coverage right away, contact our office and we'll get you enrolled right away.
Thank you, Greg. Talking about coverage, when will I get my insurance card?
Yeah, it typically takes a couple of weeks. So, it most likely would be around the beginning of February that you would get the physical card mailed to you. If you need coverage prior, if you need to see a provider prior to that, you can contact Student Health Benefits Office, and we can walk you through printing off a paper ID card from Blue Cross's website. And again, that would only be necessary if you were getting services outside of Boynton. You won't need your ID card for services at Boynton. You just need to be in sort of our system showing that you've been enrolled.
Sounds good, Greg. So it sounds like going to Boynton might be the best bet for a lot of our new arriving students. And then
it's really, and I'll just interrupt you there, that it's always your best bet to the extent that, it's a service provided by Boynton. And you saw that Boynton is a comprehensive clinic. So the vast majority of services are provided by Boynton. I would just say really the time that you wouldn't go to Boynton probably is if you have an emergency where you have to actually get to an emergency room, or if there's something critical after hours when Boynton is closed that you need looked at.
Got it. Thank you, Greg. And then one final question for you. Is insurance covered throughout the summer as well if I'm continuing to be a student?
If you're continuing to be a student, yeah, if you're for an international student, you're required to have coverage while your visa requirement requires you to have coverage while you're in the country. And so, yes, you will have the coverage even in the summer. If you're staying in the country, you'll be covered.
Okay, thank you, Greg. And I don't see any more questions for you. I have a few questions for Michelle regarding Boynton. But Greg, you mentioned earlier, if it's between urgent care and emergency care. Michelle, would you be able to explain what would be the difference?
Yeah, so an emergency is something very serious that needs medical attention right away. So perhaps you've had a significant injury, or you have a wound, you have a wound that won't stop bleeding, you have a very severe headache, maybe you have a medical condition and when it gets out of control. Those are some examples where you've broken a bone, back to that injury piece, where it would be important to get help right away from an emergency room. Urgent care is when you need help more quickly than making a doctor's appointment that you might have to wait a couple of days for. So, for example, a very significant headache, perhaps you have nausea and vomiting and you can't stop vomiting. Perhaps you have frostbite, your fingers or toes are tingly and not their normal colors, for example. Maybe you have pretty significant upper respiratory issues. If you have trouble breathing, that is absolutely going to the emergency room. But those are some examples of going to urgent care where you need to walk in. Sometimes it's hard to know. Sometimes you can feel pretty sick and you don't need an emergency room or urgent care. And that's where the nurse line can come in, where you can describe your symptoms. They can ask you a series of questions, and then they can make a recommendation for you about where you need to go. I would say most of the time, students don't need to go to the emergency room unless some of those issues I talked about, where you can get help either urgent care or through Gopher Quick Clinic or even primary care. It's also important to know that sometimes you can have a mental health emergency. And that's where if you are feeling thoughts of wanting to harm yourself or others, that's a mental health emergency, and you should be seeking care in an emergency room. During Boynton hours, we also have our crisis walk-in, where you can walk in and our counselors will help triage you to where you need to go. They may recommend that you go to the emergency room and can help get you there. Our walk-in counseling can also be used if you're feeling very stressed out, if you're having a really hard time. You can walk in during Boynton's hours and they can help you.
Thank you, Michelle. I also remember talking to a few of the mental health therapists at Boynton when they shared that mental health is not only for in times of crisis. You should start seeing a counselor when things are going well. They can help you navigate the challenges of school or just getting adjusted. So, Key, I'd like to invite you to kind of share one piece of advice for international students, but also some resources that you might have from Boynton.
For sure. Yeah. So as international students, I understand that when we arrive, we're gonna like experience, the overwhelmness of coming to a new country, meet new people, and speak, in another language, and it's bring us, kind of like a bit of, loss of sense of belongings, and we, anxiety, or we experience financial stress. So we just need someone to talk to. And I'm gonna drop the resources below. It's all around the U, and we all either resources are free and including our student benefit package. So don't be afraid to reach out the resource when you need help. I would recommend like just begin with let's talk or like mindfulness resources when you need someone to talk to, but not necessarily urgent or just want to hear kind of like a postcard. Or you can reach out to Boynton Mental Health and Student Counseling Service. Would be a good place to start.
Thank you, Key, for sharing that. Michelle, I'd like to invite you back in to talk a little bit about medications. Could I talk to someone about over-the-counter medication? Like medicine is so different around the world, right? So
yeah, so Boynton has a pharmacy right here in our East Bank clinic area. Right when you walk in the main entrance, the pharmacy will be on the right-hand side. And I encourage you to come in and see what we have in our pharmacy. We have many medications that are available over the counter or without a prescription. So for example, basic headache medication, anti-nausea medication, cold or cough medication that can help relieve some of your symptoms, bandages, those free safer sex supplies, vitamins, minerals, multivitamins, those kinds of things are all available. And you don't need a prescription. And again, the cost is very low at the Boynton Pharmacy. If you need a prescription, which means that a doctor has written a prescription for you, you can get that filled at our pharmacy, and you can talk to a pharmacist about that. If you're on medications in your home country and you want to have those transferred here to Boynton, it's very easy to do. There's a form on our website, and I will pull that up right now. And I encourage you, if you're just not sure and you have some questions about medication, you're not sure if it's available over the counter, if you need a prescription, because as Marina said, that can be different in different countries. I would encourage you to come in and talk to one of our pharmacists. You can come into the pharmacy, say that you want to talk with a pharmacist. That is free, that is no cost to you, and they can help you navigate and answer your questions about medications.
Thank you, Michelle. I have a question for Lisa or Nucci. What are some of the things I have to do once I arrive? Maybe this is a good time to remind students of their required steps. Maybe I'll start with Lisa, and then Nucci, you can add in.
Sure, I can start. So once you arrive in the US, it is really important for you to remember that you are required by your visa status to check in with ISSS. And it's really easy to do also. It's just done online. You'll just go to your My ISSS portal, myisss.umn.edu, and you'll complete the ISSS check-in form. Through this form, you'll upload copies of your immigration documents and answer some other questions about your situation to help ISSS maintain your record while you're here. Nucci, anything you would like to add?
Okay, well, we'll also be expecting all of you at our January 11th welcome dinner as well. Thank you all for attending the International Health and Wellness webinar. We look forward to seeing you on campus soon. Hopefully we've been able to address all of your questions and concerns today. If not, please know that there are many ways to contact us, as well as staying connected and up to date around information related to health and wellness. For Boynton Health related questions, you can see the email here, bh-quest@umn.edu. For the Office of Student Health Benefits, umshbo@umn.edu, to housing and residential live housing at umn.edu, and then International Student Scholar Services for new related questions, ISSSnew@umn.edu, and today you met the folks that are able to answer those questions. For continuing or returning students, please continue to email us at our regular email address, isss@umn.edu. Thank you all to the university staff that were involved in making this webinar, Michelle, Greg, and Katie, as well as all of our ISSS team members. This concludes our session for today. Thank you for attending the Global Gopher Health and Wellness webinar. We will be playing a video from Boynton, but you can definitely leave throughout the playing of the video because Michelle covered most of the content, and we will see you at our in-person welcome dinner next week. Happy New Year's, everybody.
Welcome to the University of Minnesota. We are Boynton Health, and we're excited to help you get a strong start to your college career here. We understand that it can be overwhelming to take control of your healthcare needs. That's why we're committed to helping empower students like yourself. There are a variety of clinics you can choose from here at Boynton, from primary care, urgent care, Gopher Quick Clinic, dental and vision services, gynecology and gender care, nutrition services, physical therapy, immunization, and a pharmacy. And as a student, you can access most of these services at little to no cost.
So now that you know what Boynton Health has to offer, you might be wondering how to get treatment. There are many ways to access care. You can make an appointment by calling, stopping by in person, or visiting My Boynton online patient portal. Through this patient portal, you can access immunization records, receive test results, and update your patient profile. Not sure what kind of help you need? No worries. We have a 24-hour nurse line available to help you access the right care.
Of course, after you make your appointment, you might be worried about how much it will cost. As a college student, finances can be a huge concern. Most students can receive care at little to no cost. You must meet two criteria. You need to pay the student services fee for the semester that you're enrolled in, and you need to be on an insurance plan. either a private plan or the university's plan. Most students must have insurance to be able to attend the university.
The plan offered through the university is called the Student Health Benefit Plan. It is charged to your student account alongside the student services fee and tuition. The Student Health Benefit Plan fee varies yearly, so be sure to check out our website for the most up-to-date cost. You might choose to opt out of the Student Health Benefit Plan and might be worried about paying for Boynton's health services. Don't worry. Regardless of what kind of insurance you have, most students can be seen at our clinic at little to no cost.
Boynton Health also does a lot of public health outreach across campus. We work to promote the physical, social, and emotional well-being of all students across campus inside and outside the walls of the clinic. Be sure to take advantage of programs like Nutritious You, Food Pantry, and Gopher Chauffeur. If you're feeling overwhelmed, you can put away worry and stress with Pause.
If you're a student living in a residence hall on campus or a fraternity and sorority, talk with your student health advocate. These students are first aid and CPR certified and can help with other common health related issues by referring you to other campus health resources and sharing information. These students provide cough drops, bandages, safer sex supplies, cold and cough and pain medicine. Other health promotion resources also include stress check-ins, safer sex supplies, and Recovery on Campus, which is a student group that provides support and resources for university students in recovery through social activities and regular meetings. Boynton Health offers individual therapy, couples and group therapy, and student counseling services. We also offer stress check-ins. Stress check-ins provide an opportunity for you to talk through stress in your life, come up with solutions, and to connect with campus resources.
You can find us on the East Bank Minneapolis campus and the St. Paul campus. We're open Monday through Friday during general business hours. Don't hesitate to give us a call or visit us at the clinic. You can find more information at boynton.umn.edu.
Be sure to visit MyU to fill out the immunization form and the insurance declaration form.
Thank you all, and we will see you at the next in-person dinner. Bye, everybody. Robert, you can now end the webinar.